Is swimming good for back pain? This is a question I get every single day, either on social media, via email, or in person in the clinic. And it is a great question because the answer is absolutely yes, with some shades of grey. So through this video, I'm going to explain to you what type of stroke is going to be best, when you should be doing it when you're recovering from back pain, and then what you can be doing in the long run in terms of swimming to keep your body strong and fit and independent long term. So my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic lower back pain and knee pain avoid a lifetime of painkillers and surgery. So when we're talking about swimming as a form of recovery with people with back pain, it's important to focus on the mechanics of the various strokes because there's many different ones you can do. We want to talk about how they engage the muscles and which ones are going to promote good spinal health and mobility without worrying about aggravating injuries. So swimming is an excellent low impact exercise that reduces stress through the joints like the spine, the hips, the knees, and it's going to make it really good if you are struggling with lower back pain. So we're going to do a deep dive into some of the best strokes and techniques for recovery, focusing on the biomechanics and overall spinal health. So let's start with the most popular, the front crawl. So it's really good for core activation and postural alignment. So why is it good for back recovery? Well, front crawl, when it's performed correctly, is going to give you really good benefits in terms of your back pain because it engages your core. Core being your tummy, your buttocks. It's going to promote good spinal alignment through the water without that rotation. Now, you all know that rotation is not good for discs. So we want to really build that strength in the muscles that support the spine and core, your lats and your glutes, while minimizing the impact on the back. So where should your body position be? We need to maintain a neutral spine throughout the stroke, keeping your head aligned and avoiding hyperextending the neck. So hyperextension would mean this, tipping the neck all the way back like this. That head needs to be neutral so you're looking down towards the bottom of the pool. Otherwise, you're going to cause problems with the neck as well. If you do start to hyperextend the neck, that's going to cause tension across the upper back. So you want to look all the way down to keep that neck nice and relaxed, keep that nice neutral spine. With the core, how do we engage the core? So you've got to focus on engaging that core to stabilize the pelvis and spine. If your core is weak, it's going to cause your back to sag down in the water, and that's going to cause excess hyperextension. It's going to cause the back to sag like this, and that's going to cause an increased lordosis. So that's an increase in the actual curve in the spine, and you don't want that. You've got to try and keep those hips up, keep that core nice and tight when you're going through the water. How should you kick? Well, you want to use a flutter kick. So that's going to come from the hips, not from the toes or the knees. If we're using the knees and just kicking from the knees, that can also stress the lower back. It's going to cause that hyperextension in the back. So a strong, controlled flutter kick from the hips is going to really help to support that lumbar spine by stabilizing the pelvis and give you that nice glute control. So top tip, start with a shorter controlled interval of front crawl swimming. If you're getting tired, then have a break, and you need to make sure that that form is not going, otherwise it's going to cause more back pain. Swimming with poor form can lead to overextension of that spine or excessive rotation, which is going to put stress on the lower back. Just really make sure that you're doing, say, a length to start with if you're getting back into swimming, and then build to 2 legs, have a rest, 3 legs, have a rest, 4 legs, have a rest. And a lot of the time, I think when we're swimming, we think we can just jump in and get going. It's really important you do warm up before you get in the pool. So some light, gentle rotation exercises just to help get the body as supple as possible as you go through. Let me show you. So before I was getting in the pool, if I was in the changing room, I'd be doing some light glute work here, just doing some glute bridges, helping to stabilize the core, like this. So I'll be doing 10 of these. I'll be doing 10 side to sides. And you may want to do these at home before you get in the changing room. Sometimes those changing rooms can be a bit damp or even a bit dirty sometimes. Just rocking from side to side, taking pressure off. And then I'd also be activating my lats through a child's pose like this, just rocking from side to side. So these 3 exercises shouldn't take longer than 3 minutes, just to help prime my body before we're getting in the pool. Stroke 2 is going to be backstroke, best for lumbar support and decompression. So why is backstroke so good for back pain recovery? Well, it's one of the best swimming strokes when you're struggling with it because It allows the spine to stay in a neutral position, and you can really push your hips through to do it rather than being on the front and having to push up. It's much easier to do it when you're on your back. Now that horizontal position helps to take pressure off the spine with reducing the effects of gravity and relieving pressure on the vertebra. That's why it's so great to be in the water, because you haven't got any gravity on you and you can then move the joints without having that impact. So you need to make sure the spine is aligned, maintain that nice flat back, avoid overarching the lower back when you're looking back, engaging that core, tighten your pelvis, and keep it in that neutral position. If we are really trying to overarch and push through with your arms like this, it can jam the facet joints up in the base of the spine, and you don't want that. So just keep it nice and fluid, keep it nice and flat. So how should you kick? Well, very similar to front crawl. Avoid kicking from the knees, make sure you're kicking from the hips, and avoid that over-reliance on the toes as well. Head position, well, the head position again should be neutral, looking straight up. Obviously you're on your back now. Avoid tilting it backward, because that's going to hyperextend the neck and put pressure onto the upper back. And the water should really reach up to the middle part of your ears here, okay? Where should the shoulders be? Well, the shoulders should have some gentle rotation on them during the backstroke. That's going to help to improve the thoracic spine mobility. So essentially when you're going back like this, you want to just gently rotate the arm in the water. So it's that internal rotation there, and that's going to help to just take pressure off the rotator cuff. Pro tip, backstroke is great for spinal recovery because it doesn't require you rotate, so very similar to front crawl. That's very important if you're recovering from lower back injuries, especially disc issues. Discs do not like loaded rotation or any sort of rotation really. Don't let your back sag, that's going to undo the benefits of this amazing stroke. Okay, number 3, breaststroke. Great for low intensity. We see a lot of people doing breaststroke when they're recovering, but there is one caveat to this. So it's great for individuals with like a mild back pain or when you're recovering from injury, but only when it's done with good attention on form. So if you ever watch Adam Peaty do breaststroke, it's very aggressive, there's strong arms, strong kicking with the legs. You've got to be careful when you're doing breaststroke legs. So you need to make sure that the timing and the technique of the stroke are precise to avoid any issues with the back or exacerbating them. So let me run you through those. The body position. So the key to performing breaststroke without back pain is to maintain that flat body position in the water again. I know I'm going on about flat position, but I can't emphasize that enough. So don't let the hips drop down so that you're too low in the water. Again, that's going to cause a dip in the lower back, a hyperextension. So keep everything nice and flat. The leg kick, well, that's a frog kick. So the legs go out like this. It's a whip kick, and that can cause problems with the lower back. So for me, I actually prefer a flutter kick with breaststroke arms. I think that is the best stroke when you're recovering from low back injury. You want to avoid that aggressive snap if you are going to do breaststroke legs, and really the kick should be coming from the hips, not from the knees. Because if you're struggling with a knee issue, that can often put a lot of pressure when you're doing breaststroke legs. So just take it very gentle. The neck, again, when you're dipping your head down like this, there's a tendency to have that increased hyperextension. And then when they're coming up to breathe, a lot of swimmers will accentuate that extension, and that can put pressure onto the neck as well. So just keep it nice and light. Some people like to just keep their head out of the water. That's also fine as well, because you're going to get some movement through the arms and the legs. Where should the arms be? Well, it's a nice wide arm sweep with minimal drag to avoid that over rotation in the lumbar spine. So make sure you're timing those arm movements with a gentle forward propulsion. That's going to help to stabilize your core and your back. So top tip for me, breaststroke, it should be approached with caution, but I think if it's done correctly with flutter leg kicks and gentle drag arms, it is one of the best strokes when you're recovering from back pain. If you can't do it correctly, then I would 100% focus on backstroke. Just do that nice and gently through there. So number 4, side stroke. Well, this is great for spinal alignment. It's an amazing and often overlooked swimming stroke, but it can be incredibly beneficial if you are struggling with back pain or recovering from injury. So essentially, you're lying on your side, and I'll walk you through where the legs should be and the arm should be here. Rotated onto your side, the legs are going to work in a scissor kick pattern like this, and that's going to help to promote spinal alignment, keeping the hips stacked over one another. You want to keep the body nice and straight, so straight line all the way from the head down to your toes, and you're going to avoid bending at the waist. You don't want that waist to kind of, like if I was like this, you don't want to sag down like that or sag down like this. That's going to put strain on the lower back. With the kicking, the scissor kick should come from the hips again, so not from the knees, and it needs to be nice and controlled to prevent those jerking movements that irritate the spine. Keep it very gentle but effective for propulsion, okay? The arm, so one arm is going to be out like this, extended in front of you, and you want to make sure you're not rotating your head like this. Keep the head upright, and the other one just kind of sweeps along the side of the body here. You might want to just hold it onto your hip. The key to this stroke is like a rhythmic fluid motion that doesn't require more rotation. So top tip for my side stroke, great for cooling down, great for warming up. It offers a less intense option for days when your back may need a lighter workout, but it's especially helpful for those struggling with sciatica, as again, it minimizes that rotation through the spine. Number 5, butterfly. Okay, absolutely do not do butterfly. So the reason is it requires so much spinal undulation and forceful arm movements, both of which can really aggravate lower back pain. So for me, butterfly is an absolute no-no. It's very explosive in nature and can overstress the lumbar spine and might cause overextension of the back. And that overextension, that hyperextension we talk about in the dolphin kick is exactly what we do not want. So the butterfly stroke, it's great for strengthening the core muscles, that's fine, but so is a deadlift, but the risks are just far outweigh the benefits, and the aggressive nature makes it really unsuitable for a lot of people struggling with back issues. So in summary, it's really important to engage that core, sucking the tummy button in, squeezing those glutes. It's going to help to stabilize the spine. You also want to make sure that you have controlled breathing mechanics. That's essential for spinal alignment. The diaphragm is going to help to optimize the thoracic cage, and avoid hyperextending your neck when you're coming up for air, especially during freestyle and breaststroke. So keep that nice and neutral and a gentle movement from side to side. Avoid sudden jerky movements, especially during the turns or kicks, and focus on smooth, controlled strokes that glide through the water, and also strengthen supporting muscles outside the pool. Things like planks, side planks, glute bridges, incorporate those into a workout routine, and that's going to help to strengthen the support muscles around your spine during swimming. Okay, so there we have it. Let me know how you get on in the comments below. If you like the video, please hit the like button. Please subscribe to the channel for our regular updates. And as always, you can grab copies of my best-selling books here, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and How to Transform Your Back. We'll see you next time.